At the beginning of the COVID-19 pandemic, there were huge fears about how Africa would deal with it when it got here. It's nearly 8 months since the first case was confirmed on the continent, and Africa appears to be the least impacted region so far. The continent of 1.3 billion people accounts for less than 5% of all cases globally and under 4% of deaths. Health experts also say the disease has been less severe among Africans who are infected. Now, let's try and make sense of how Africa has averted the predicted disaster. Right from the beginning, African countries took drastic measures swiftly to prevent infection. Some countries, like Lesotho, declared a national emergency, closed schools, and locked down even before they had a confirmed case of COVID-19. Public health measures such as stopping handshakes, frequent hand washing, and screening of potential cases started immediately. In fact, in some countries, it was just a continuation of what they already had in place because of an ongoing outbreak of Ebola in the Democratic Republic of Congo. Which brings me to the next point about how many African countries have vast experience dealing with outbreaks of infectious diseases. You know how people tap elbows to greet now? That was already used in West Africa during the 2014 to 2016 Ebola outbreak. They called it the Ebola then. And in Nigeria, polio vaccination teams quickly turned their attention to COVID-19, using their extensive contact tracing and public education experience to deal with a new challenge. It is in such established community systems which are trusted that Africa's strength lay. And they helped to prevent a large outbreak which would have no doubt overwhelmed the fragile health systems. Now, to understand the less severe outcomes in Africa, one needs to look at the population. The continent is home to the world's youngest population. The median age is only 19 years, compared to Europe's 43. It is well known that COVID-19 affects older people more severely. Where they live also matters. Some of the worst outcomes of this pandemic have been in care homes for the elderly in developed nations. Such care homes are rare in Africa. The elderly are cared for at home, often in rural areas where most people retire to, and they are sparsely populated. Now, underdeveloped transport infrastructure has also meant that Africans do not travel as much as other people in the rest of the world. That minimizes contact and the spread of disease. And finally, various researchers have been looking into climate and the spread of disease. I spoke to scientists from the University of Maryland in the US who say that they have found a correlation between the spread of COVID-19 and temperature and humidity. This does not mean that Africa has overcome the pandemic. The number of new confirmed cases and deaths has been reducing over the last 2 months. Good news. But public health experts are warning against complacency. Many countries that relaxed public health measures they had taken earlier on reported a spike in infections. The World Health Organization says that the outbreak in Africa is likely to smolder for much longer.